Hi, I am Dr. Gold CWE Manuel, and Afro Psychologist is my brand. Today I'll be explaining the difference between a medical doctor and a psychologist. When is it right to visit a psychologist or see a psychologist? And when is it you visit your or see your medical doctor? The difference between a medical doctor and a psychologist is that the medical doctor administers drugs to a patient, while a psychologist understand or try to understand behavioral pattern or various environmental or social factors that might actually lead to a particular situation that a person is facing. For example, you have a person who's gone through a life-changing situation like a break in a relationship or a failed marriage or going into a new relationship, getting married, for example. They're all life-changing situation like a parent dying or the other half dying, or parents aging and being diagnosed with dementia or Alzheimer's. They are all life-changing situation. Sometimes when a person gives birth, it's a life-changing situation. And research has actually found that most of the people who have babies for the very first time, or each time that person have kids, they develop postnatal depression. So things that actually have to do with fluctuation of your system or neurotransmitter or hormone, they're life-changing situation. You're previously in a relationship where your partner was demanding something which you've never been asked for in a previous relationship. It's so new to you, you're not used to it, but because of fulfillment of certain you're trying to please your partner, you're trying to do things to make them happy, it is a life-changing situation. I'll give you examples of situational reaction. Situational reaction is suddenly you hear a sad news. And that sad news is maybe a loved one died, maybe a parent died, maybe a friend, something happened, an accident or a trauma or something happened to a specific person that is really close to you. And you have this sort of instant reaction, which cause for you is causing anxiety, sudden depression, sudden situation that makes you anxious, and you begin to feel like you're unwell. That is a situational reaction. There are, in that sort of situation, medication that help in that particular point in time to help that particular situation. When you cannot cope with that situation for a long time and you start having a long-term mental health problem resulting from that particular situation, then it's time to look for psychological intervention. When a situational reaction begins to prolong into a long-term depression or stress or other kind of mental health problem, then you need a psychologist. What then happens is how the intervention now works with you as an individual. So a psychologist look at you as the individual and work with you to help the healing process. So there is a situation where they look at your environment, what is going on within you, how many of that sort of situation has occurred within your family, how can the environment influence what is going on at this particular time. Do you need a change of environment? Do you need a change of relationship? Do you need to get out of something which is actually adding to that situation? Do you need to move away from factors that is responsible influencing that particular situation? Domestic violence, for example. If you're in a relationship and you're getting abuse, verbal abuse, physical abuse, any kind of abuse in that relationship, you begin over time, you begin to develop some sort of withdrawal either from the the social environment, either from families and friends, and then obviously these are signs and symptoms that something needs to be done, and you probably need to talk to someone. In that situation, what is ideal is what you would probably be told, that if your situation, if your environment is affecting your situation or your healing process, why don't you give it a second thought and think of changing that environment? So most of the advice that you get from a psychologist, or most of the assessment you get from a psychologist, are based on behavioral patterns and causes of behavioral patterns within a particular person, internal and external environment. Research has found that medication help reduce symptoms. So when you take medication, when your doctor gives you a medication, it helps reduce the symptoms. Sometimes the side effect of the medication could lead to other kind of health problems where you're now being diagnosed with something else, and then you still need to start taking medication for this something else which you've been diagnosed with. The long-term effect of drugs, well, the argument basically is drugs reduces the symptom but doesn't really cure that person. But it doesn't necessarily mean, and I'm not advocating in any way, shape, or form, that you shouldn't see your medical doctor. I'm trying to explain that the psychologist and the medical experts can actually be viewed as a holistic approach to creating an effective and holistic healing system. So if you merge both of them together, you take the psychological pathway, and then you go the medical pathway, then you can have a proper, you can have an effective method of healing, or an effective kind of intervention. Again, I needed to say something about my intervention, which is the biopsychosocial. Biopsychosocial normally will be looking at the biological aspect of a person, the psychological aspect of the person, and the social environment. But my intervention, which I introduced a few years back, is psychosocial cultural. And psychosocial cultural, I would explain in a nutshell, is me understanding people from different culture. So I look at the person and their social environment as well as their culture. I think that is really important, particularly in a multi-cultural society where you have people from different culture, they believe in different things, and you have this social culture which is already established in the United Kingdom, for example. So they have that culture coming from a different cultural background into a social established background, and then bringing the individual self into that particular culture. So what I did with that intervention is to understand that person, the environment which they're in, and the culture in which they're brought up. And that way, that intervention helped to not only understand the person as a person, but also the culture in which they're coming from, the religion, the belief, and the influence of the social environments which they find themselves. Do you then need to see a psychologist? I'll leave that up to you. But the importance of a psychologist cannot be undermined and cannot be ignored. There are situations or society that do not actually see or know the importance of the effectiveness or the efficacy of seeing a psychologist. But then again, there are untold or unseen mental health challenges which is going on in different environments which haven't at this particular time even been diagnosed within the context of this particular culture. It is important that psychological intervention is given a huge consideration in some of this environment, and that is what I'm trying to push forward. And as I continue to delve into psyche talk on the forum, on the Facebook forum, then I'm beginning to shed some more light into my psychosocial cultural intervention, and how culture can also help in well, you have a three-way thing going on. You have the person, and then you have the social, and then you have the culture as well. We can do like a bottom up where we start understanding the culture, the social, and the person. Anyway, it is Dr. Gold, CWE Manuel from Afro Psychology, and I will be looking at erectile dysfunction next, where I'll be talking about the importance of psychosexual intervention in erectile dysfunction. Erectile dysfunction is a topic which I will be looking at in different parts, because I'll be looking basically at the relationship problem, which could be a factor for erectile dysfunction. I'll be looking at performance anxiety, which is basically within that relationship, and anxiety that comes during that period of time where where you're basically wanting to get a penile erection, and you're not able to do that. I'll look at various psychiatric disorder that are likely to affect erectile or penile erection, and also look at things like stress, depression. Yeah, so I hope that I have been able to give some sort of introduction into what the work of a psychologist is, and when to speak to a psychologist. And can I just say at this point that you don't have to wait for any specific time to speak to a psychologist. If you have anything at all which you feel like you need to discuss with anyone, you feel free. You go, you talk about things, you talk about life, talk about relationship, talk about some of your challenge. You can talk about your work, you can talk about how things are affecting you generally, and what you find interesting and what keeps you going. Until next time, when I come back to you, I would say it's Dr. Gold Emmanuel, and I look forward to another of this interesting topic. Bye.